Hello, my name is Karen. Thank you very much for working with us as our standardized patient this year for our first midterm with these young students. I'm going to run through the idea of what we're going to have you role play. So there's basically when the student comes in to see you, they will be working with an arm for one task and with your leg for the other task. There is a first group called Scenario A, and then there's a second group called Scenario B. What the students have to do is very similar in both scenarios, but it is for some test integrity and for two different lots of students. So with regards to the arm, the first thing you would need to do is when they ask you to lift your arm, you're unable. So you cannot do normal lifting of the arm. You just can't do that. It's sore, it's weak. And so what I'd rather you do is lift the arm like hiking with your shoulder. It's just so heavy, you can't lift it. So it means you're kind of bending away, hiking your shoulder and trying to lift it like so. And you're unable to get it any higher than halfway, and you just you certainly can't do it normally. You're hiking, side bending, hiking. If it's to the front and if it's to the side, exactly the same thing. You can't possibly get it there. So if you wouldn't mind practicing that role playing, that'd be great. What they should be teaching you is to use your other hand to assist it going up, or ask you to walk to a wall and assist it by walking up the wall, assisting up. Or perhaps they might have you be beside a platform like a table surface and have you kind of walk along the surface. There's a number of different things. They could take a towel and ask you to, with the good arm, lift the arm up with the towel, both standing or sitting or lying. They could take a stick and ask you to push it up with the stick. So there's many options for them to help teach you something to get the arm moving. But please just follow the directions, whatever they ask you to. They may give you a stretchy tubing to do something with the arm. It's probably not going to work so well, but they may. Just follow their directions. Please ask questions of them if you don't understand their directions. On the flip side, please don't ask questions for just trying to create a real environment, because they have a very limited amount of time to show us their skills. It's a very short amount of time, so I don't want to waste their time getting them off topic. But if you don't understand what they asked you to do, please ask clarification from them. That will be the arm. So both scenarios have an arm task. One is asking the arm to go to the front, one's asking the arm to go to the side. And your role playing is the same for both. Now for the leg, one scenario will be talking about stretching the back of your leg, your hamstring, and one will be stretching your calf. Now in this case, you mostly just have to follow the student's directions, because they will be doing the stretching on you. Please don't let them go into any discomfort, any real discomfort for you. You don't have to role play that as much as don't let them pull on you to any point of discomfort for you. The priority is keeping you safe. But I will demonstrate slightly kind of the general directions that will take you in. Now, in order to stretch your leg, they really must get you in lying down. So hopefully they do that. And so usually they would have you lying on your back, and they would come and be beside you and or sitting on the edge of the bed, and they will help lift your leg, and they will either bring your leg up such that it's in a straight leg lift to get the stretch down the back, or they may bend you up and then take the rest of your leg into whatever point it can go, again, to create the stretch at the back. There's basically two options they have. Once they have your leg in that stretch, they might ask you to push down into them, straighten your knee. Whatever it is they ask you, please just follow their directions. Now, the other one is the calf or the ankle. So that's just basically they're going to have you pull the toes up. So get a little more of the frame here. They're going to scoop up into your foot and pull your toes towards your shin to create a stretch down the back. Again, they may ask you to push your toes towards your nose and pull the toes further up, or they may ask you to push down into them. Whatever it is they ask you to do, please just follow those directions. But other than that, that's pretty much it. So for the legs, you follow the directions, and certainly speak up if anything feels uncomfortable to you. And for the arm, please just do the side bending, shrugging, that it's just so heavy you can't lift it up on its own. And that's pretty much all there is. So we look forward to seeing you, and thank you again for helping us out.